Testing. One. All right, we're good. Yeah, just throw the Kama Sutra at me, why don't you? Jesus, folks, you believe this? Guys, do any of your wives just fling the Kama Sutra at you?
I do.
If the answer is no, you should join that club. So what up, YouTube? We're back. Vinny, right? That's my name? Vinny.
Dumbass.
No. Vinny and Casey. We're back with another episode, and before we...
What's the name of it?
How to Not Interrupt Your Husband. Before we delve into what this video is going to be about, I just wanted to give a message to our more perceptive viewers. I do own more than one t-shirt. What are we talking about today, baby?
Oh my god, that's right. You were wearing this shit.
I know. What are we talking about today, baby?
Today we're going to talk about IVF and the lovely shit that we're going through. Or actually, no, that we did go through.
Yeah.
But then what we're currently going through now. So, wine time.
Oh, you know what? Let me go grab my humongous glass real quick. Alright. If any of our viewers are espresso drinkers, I've seen bigger espresso mugs than this.
Yeah.
Anyway.
Cheers.
Cheers, baby. So yeah, we're going to be talking about IVF today and the lovely shit that we went through.
Yeah.
And the current road that we are still traveling.
Listen, first and foremost, I want everybody to understand that IVF is not to be taken lightly. IVF is hard. It's painful.
Oh, yeah.
And if you as a couple, or even just an individual, are going through it, kudos to you. And I wish that it would be talked about more, because I think that people put, I don't want to say a bad name or a bad light to it.
Like a stigma?
Yeah, kind of like a stigma, because a lot of people believe you should just be able to conceive naturally, but
right. If it was only that easy.
Yeah, this day and age, there's a lot of reasons why women can't, even men. It's not always just the woman who is having the issue, it's the man as well.
Definitely not.
So, kudos to you. If you're going through it,
cheers to you. Yeah,
we're with you.
Just like my wife just said, you know, just like anything else in a relationship, it's teamwork, okay?
Mm-hmm.
It's a partnership. It's going to be not so bad sometimes, but like my wife said, there are periods where pain will kick in, and you have to have the right mindset and the correct level of perseverance to get through it in order to attain your goals.
That's right.
Right? So how did we start, baby?
We started by finding a reproductive endocrinology doctor. And a lot of insurance companies now will pay for IVF, so it's, you know, as simple as you can go into your insurance, call them, and find out who is in your network. Or, unfortunately, if your insurance doesn't cover it, then you can find whoever you want through reviews. I think the best thing to do is go online, definitely Reddit,
Yeah.
and find out through there who people would recommend in your area. But definitely look at reviews. That's most important, because you want to make sure that who you're going to is actually going to see you as someone struggling and who wants to get pregnant instead of just another number.
Definitely.
That's a big, big factor in this. So we found our doctor, and he's absolutely wonderful. I think he's the sweetest thing, and he is very attentive, and he listens to you. He takes the time to address your concerns and what you're thinking and explain the process of everything, which is great.
We going?
Yeah.
Oh. Sorry for that little delay, folks.
I don't know where we left off, though.
Why don't we just start all over again?
Okay, so anyway, figure out with your insurance plan if they will cover IVF. Most will nowadays. So find a doctor, look at reviews, go on Reddit. I love going on Reddit. There's a lot of really good stories, opinions, reviews, all that good stuff.
Definitely.
Yeah. So again, we found our IVF doctor. He is a wonderful man. He doesn't just treat us as another couple and just, throw us to the side and just, see what happens. Takes the time to listen, to go over options, which, I didn't have options because my previous little man was an IVF baby, so that's just the route I've had to go. So we actually started in May, right?
May, yeah.
It was the beginning of May.
Yeah, now we're in the second week of August.
Yes. What was that? So anyway, so in May, once I got my cycle and I started, I had to go for blood work and I had to go for ultrasound just to check my ovaries, the amount of follicles that I had in each ovary, check the lining of my uterus, things like that. And then I had started injections. The biggest thing is the injections, they only lasted for what? I was injecting for like a week and a half.
Yeah,
maybe.
If that.
Each day, actually each night, because you inject at night. Well, I did. Everybody might be different, so don't just like quote me and take what I say and run with it. I injected Menopur and Follistim, specific amounts every night at the same time. And each day, I would feel my ovaries start to get bigger and bigger because of what this medication is doing is it's overstimulating every single follicle that is in each ovary to make them grow so that they can eventually remove them and hopefully make an embryo out of them. So let's just say my right ovary had, I don't know, say 10 follicles that this medication was overstimulating. So I had 10 follicles growing on my right side and 15 on the left. So you feel the weight of these follicles growing every day and you feel like such heaviness and pressure in your pelvic area.
Mm-hmm.
That's why I say, like, IVF is not for the faint of heart. Like, it is very, very, it's intrusive.
Yeah.
It's very intrusive.
Physically demanding.
Physically demanding. Absolutely. It's emotional. Very, very emotional. But, like, thank God I have this man right here. Because he took the time to learn. This man has no medical background. I do. He does not. He works outside. He's a blue-collar man. Love him to death. But he knows nothing about medical.
I did put a Band-Aid on myself once, though. But that's about the extent of my knowledge.
Oh my God. But this man right here took the time to, the first night, watch how I filled up the syringes and then injected myself. And then after the first night, babe, really? Smoke effect? It's not Halloween.
You're right. I apologize.
Thank you. After the first night, I didn't inject myself anymore. It was always him. And I loved him for that. And it actually got to the point where I was kind of jealous because I wanted to inject myself. But this guy right here just took the reins and I never touched a needle again after that.
No, like I said, it's a teamwork thing, right? So if a husband is going to be there for his wife or if a wife is going to be there for her husband, it's got to be as 50-50 as often as it possibly can.
Mm-hmm.
Okay? Not just with IVF, with any sort of relationship. Okay?
But when you're going through IVF, this is something that's very sensitive. So as a couple, you need to be there for one another.
Yeah.
Because your ultimate goal is that you want to grow a family, you want to have a baby. And it's when I say sensitive, I mean it's sensitive. So you two need to be there for each other. You need to talk to one another because communication is the most important thing when it comes to IVF. Talk to each other. Get your feelings, your emotions out, everything. Whether you're scared, you're excited, you're nervous, whatever the case is, talk about it. Talk about everything. Yeah. That's what we do.
For sure. You know, communication is going to be the benchmark in any relationship, in any situation that you could find yourself in. Like, you know, regardless of how well I know my wife, or regardless of how well my wife knows me, our heads are not see-through. Okay?
That's right.
So just because I could finish her sentences and know that she's feeling a certain way based on her body language or how she's saying something, it's not something that you're going to want to incorporate a lot of guesswork into. Okay? Like she said before, the first night she was showing me how to properly, you know, fill the syringes with X amount of milligrams or milliliters?
Milligrams.
Milligrams of medication. So I'm watching everything.
No, I'm sorry. The wine's talking. MLs.
Okay.
MLs.
Milliliters, not milligrams. But there's a few steps to the process. So I watched the entire thing from beginning to end. I don't think I even blinked because I don't want to miss anything. I knew that I wanted to be a part of it. I knew that my wife likes to sit and rest her arm on my butt.
I was just going to ask you if this is comfortable.
Oh, yeah, it's totally fine.
Good.
Please, by all means.
So, another big thing is when you are injecting these medications at night, pretty much, maybe every day, every other day, you're going back to the doctor for blood work and an ultrasound. And these ultrasounds are put right in your mother hole to get a really good view of everything because they need to measure. They need to measure your follicles because they want to take them out when they get to a certain, what's that word?
Bread. A certain size.
Yes, thank you.
You're welcome.
It's the wine. When they get to a certain size. So not only are you injecting yourself, your arms are getting beat up on almost a daily basis for blood work. Your poor vagina is getting probed all the time. And all the while, you feel, like I said, this pressure, this heavy feeling in your pelvic region. And you're, at least for me, I was literally walking around and I looked 6 months pregnant because of how big my ovaries had gotten.
Oh, yeah.
Like at the very end of it, like your ovaries are like, okay, let's go like this big, like tiny, 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 tiny. By the time you're done, they're the size of like mangoes. And there are a lot of women who have what's called PCOS, where your ovaries produce way too many follicles. And these women are having egg retrievals done. I know I'm getting ahead of myself, but they're having egg retrievals done, and they're having almost 60 follicles taken from both ovaries.
That's a lot.
Collectively. Like all together. Right? That's what collectively means? All together?
Yes.
Okay, thank you.
Yeah.
Thank you. So it's very taxing on your body. And again, like I was literally walking around with like a belly because I looked pregnant, I felt pregnant, and I was so miserable and uncomfortable. But again, it's all a part of the process. This is what we have to go through. And so thankfully, I had this man here taking really good care of me. He got me Crunch bars and injected me and took me to all of my appointments. Like he was there. Like if my son, unfortunately, my fertility doctor does not allow children in their office because, you know, they have to be sensitive to other patients and, you know, the women who really cannot have kids or, you know, they've tried and they just keep failing cycles and all this stuff. So my child's not allowed in that office. So when I had no choice, if he was with me, my husband would stay in the car with him and the two of them would FaceTime me. Like my husband always wanted to be involved. He
always
asked questions. I felt so bad because the one day he kept asking questions, and the doctor, I think she just wanted to like get out of there and just go to the next room before he asked another question.
Yeah.
But she's so sweet, and she stayed, she talked to him, and she just kept like reassuring him like everything's good, your wife's doing great, yada yada. So again, everybody is different with how quickly their ovaries will overstimulate all these follicles. So I was done, I want to say it was literally just over a week, maybe a week and a half of injecting myself with these hormone medications. And the day came where my follicles were all the right size, and they were like, all right, you're going to trigger tonight. So when you trigger, this is the last step in the medication that is going to mature the follicles right before they are taken out. So I trigger that night, which that shot was a bigger needle, had to go to my ass.
Yeah.
And he did it.
Yeah.
What did you think of that one?
I thought
was it
all
frightening?
Right.
Because the other needles they're tiny.
Yeah.
They're like diabetic needles.
They are pretty small.
They're insulin needles pretty much.
Right. And listen, just because the needle is, smaller or the gauge is smaller, there is still a little bit of pain. But, my wife troopered through everything. And
Thank you.
One thing you need to keep in mind is that I know that you're watching this video, you're obviously not going to get the full grasp of the situation just based on us talking about this for 10 to 15 minutes.
Mm-hmm.
But before you begin, like my wife said, the anxiety is there, the nerves are there, but you need to always keep in your head that even before you begin, there is light at the end of the tunnel. And when you finally get to that last shot, that last night, it's a big relief,
It
obviously.
Is. Oh my God.
My wife said it is a little bit bigger of a needle, but I wasn't apprehensive. I wasn't nervous. It went right in. She was all done. And that's it.
That's all she wrote.
That's really it. That's all she wrote.
And then the next day, you get up, you go to the outpatient clinic center, whatever your hospital or your fertility doctor is associated with, and you are put under a light anesthesia. You're not, I think I was fully knocked out.
Yeah, you were.
It wasn't twilight. I was fully knocked out.
Right.
So, met with the anesthesiologist. They hooked me up to the IV and just, went over like the basic things when you're at the hospital, like medical history, family history, allergies, meds, like the works, So, I left, they wheeled me out. I left my husband in our little like cubicle area that we were in. And I remember going into the OR and it was cold. It was very cold in that room. And I guess rightfully so, because I'm sure that these doctors like sweat during these fucking procedures because I know I would. So it was freezing in the room, and the bed that I had to be transferred on, I was laying flat and they had the arms out like this. So I had to lay like this. And then they had, I don't even know what to call it, but it was this metal rod that had these straps hanging from it. Because essentially, I am so doing this right now. Essentially, what they needed to do was have my legs like this. So, I was knocked out before they even put my legs in those strap things.
Yeah.
Yeah, I just remember looking around the room, and the anesthesiologist came back in, and she was talking to me, and she told me that she was gonna start giving me some medication to like make me relax. And then the next thing I know, I woke up in recovery, and I could feel the pain. Like I felt the pain in my pelvic area, because what they do is they're inserting a needle into each follicle to take it out. So you have a needle poking your ovaries over and over and over and over, because they want to get every follicle that has hit the size that they wanted. So we had gotten 20 or 23?
23.
23. So we had gotten, when I came out of surgery, 23 follicles. At the same time, he had already given his sample, which was fun, right?
Oh, yeah. Yeah.
You did that here.
Yes, I did.
You had to jerk off in the bathroom.
Yep. Right into a tube.
A cup.
A cup, whatever.
It was a cup.
Cup, tube. Yeah. Very odd to have to do that.
Anyway, he had to jerk off in the bathroom while I stayed out here. And I remember at one point, didn't you ask me to come help you?
Yeah.
But I can't.
Of course.
You can't mouth, hands, you can't, like, touch.
Right.
And possibly contaminate.
Yeah, you have to have fun by yourself.
Yes, exactly. So, while my follicles were being, removed and going to the embryologist. Embryologist, thank you. It's the wine. They were being, my follicles were being put with his sperm so that the sperm would find the follicle, meet each other, say hello, what's up, go have coffee.
Yep. I was just about to say, have a drink.
Have a drink, and then connect. And hopefully continue to grow, which we were very fortunate enough that out of those 23, 14 connected and grew and grew and grew.
Yep.
Until day 5. And then at day 5, they were each biopsied and sent out for what's called PGTA testing, which is a company that will test like the cells within these embryos to make sure that there's all the chromosomes, there's no abnormalities, nothing like that.
Yeah.
So out of 14, we have 7 normal babies.
Yep.
4 boys, 3 girls, and then another 3 that are called mosaic, which they're not abnormal, but they're also not normal. They don't know exactly what's going on with them.
Right.
So my doctor had advised us that he's not going to, discard of them. He's going to keep them as like a very like last resort type embryo. So if we end up going through all 7, they don't work, then we'll end up using the other 3. Right. But
which hopefully we won't have to worry about.
We won't need to.
Yeah.
So that's where we are now. I mean, listen, I didn't handle recovery very well this time. First time around, I bounced back pretty quickly. I was also younger. I was 29. Now I'm 36. So I developed what's called OHSS, which is ovarian hyperstimulated.
Ovarian hyperstimulation syndrome.
Thank you.
You're welcome.
Love you.
Love you too.
So it was a lot. There was like fluid building up in my abdomen. Thankfully not a lot, but it was enough that I was feeling the pain and I was very uncomfortable. I tried to go back to work the day after the retrieval, and I remember walking in and I went to walk to get a patient and I just started crying because the pain that I was feeling in my pelvic area was so bad. And I ended up, thankfully my my infertility doctor is in the same building as I am, so I just went right upstairs to him, checked me out. They ended up giving me some pain meds and told me, you gotta go home, you gotta lay down, you gotta be on bed rest for a few days. So that's what I ended up doing. My retrieval was on a Wednesday, so Thursday and Friday I ended up staying at home, and then all weekend, and then by Monday, like, I was pretty much back to normal.
Yeah, she was good to go. Definitely.
I think it took until almost July for me to get like fully back to normal. Like, I still had the bloatedness from all the hormone injections. And yeah, I don't think that came off until recently.
Yeah, definitely.
The bloatedness.
Yeah.
Yeah, that took some time.
Yeah, so it's going to linger around for a little while, but it's not something that my wife did not power through, and it's not something that any of you who may be experiencing the same thing that my wife experienced can't power through.
That's right.
So listen, there's trials, there's
Sorry,
tribulations,
I'm texting my mother-in-law.
and the juice is worth the squeeze.
It is.
For sure.
So right now we're in the very beginning of our embryo transfer. So we went over this past weekend, which I had said in our last video that this was my last glass of wine, but it is not, because embryo transfer is going to take a few weeks. So I can still do my normal everyday things until we do the transfer. Right. So we went over the weekend to the doctor. You know, they did the normal vaginal probe, checked out my uterus, my ovaries, and I won't go back until next week for another checkup. But right now, we are doing this unmedicated, which is this is the first time I've ever done a transfer without medication. So I myself am a little bit worried because I don't know what's going to happen. I don't know if my body's going to be able to produce my hormones naturally. What the nurse had told me was what they're looking for is a certain thickness in my uterine lining before they transfer, and also my progesterone needs to be over a 1. So I'm very, very hopeful that my body is going to do what it needs to do. And in a few short weeks, we'll be able to, you know, go back to the outpatient hospital and have our little girl transferred.
That would be nice.
Yes, it would.
We are hoping for a girl. I know what you're saying. Dude, you're a guy. Why the hell do you want a daughter? I don't know, guys. I just do. I'd love to have a son, but something about, like, daddy as a little girl sounds nice.
That's right.
For sure.
You're going to be the perfect daddy's girl. You really are. With how you treat me, I'm excited to watch you with our daughter.
Well, thank you. You're going to do a very good job yourself. You're already a living example of that.
Thank you.
So, I'm sure you're going to persist.
This is getting too sentimental.
Well, this is a sentimental, sensitive subject.
I guess so.
But, you know, we briefly touched on, you know, like the beginning process before, the little bit about insurance. Guys, do yourself a favor. Ask questions, okay? My job is tied into county government. So I have an excellent benefits plan that I'm on. Obviously, my wife is on. I've paid like cents for prescriptions before. I'm currently going to an allergist. I pay nothing out of pocket. Coworkers of mine, my one buddy Jay, he has his wife on his plan. They have delivered 2 of their 3 children under this benefits plan. They walked out of the hospital free of any bills. Figure out what you're going to have to pay and what's going to be covered, okay? Because my insurance covers a lot of this process, but there is a cryogenic freezing part of it, which my insurance does not cover. And
most insurances don't, because it's
right.
a yearly fee
yeah.
of, I mean, most places it's like $1,000, maybe a little bit over. Our place is $1,000 yearly.
Yes.
To keep our babies on ice.
Yes.
So most insurance companies won't cover something like that, and a lot of companies also won't cover the embryo, the testing, the genetic testing.
Right.
So you have to ask questions. You have to be aware.
Yeah.
Okay?
Without a doubt. You owe it to yourself to have all your ducks in a row.
Yes.
All right. If you've never been through it before, maybe you don't know what types of questions to ask. You don't know what answers you need. Just do a little bit of research. Take some time out of your day. Fill your head with as much knowledge as you possibly can, and ask questions so you can get your answers.
And ladies, even the guys, I'm more than happy to answer any questions that you might have. Just reach out to us.
Yeah, for sure.
We're very open.
Yeah, definitely.
We'd love to chat about whatever, any concerns, any questions. Just give us a shout.
Yeah. Like, subscribe, comment, sticky note, email, facts, whatever.
Smoke signal.
Smoke signal. Listen, we're here. Okay, this is the whole point. We want,
Yeah.
you know, like we said in our first video, we want this to be a very interactive channel. All right? Maybe we can get some wine together one weekend.
Oh my god, that'd be amazing. But if I'm pregnant, then just get me a mocktail.
Yeah. Or just grape juice.
No, I don't like grape juice.
All right, fine. Mocktail it is.
Mocktail.
But yeah, guys, like I said, like my wife said, hit us up. We're here.
We're here.
All right?
We love you.
We love you guys. Good night, good night, YouTube.
All right, go get the yogurt pie.